Yes, good morning, good afternoon, and for some of our viewers, good evening. It's a great pleasure and honor to welcome two distinguished guests today. They are working in the healthcare industry, and they are doing a big difference, and we are honored to work with them using XR, virtual and augmented reality, for that purpose. The first guest is Tiffani Ghere. She's the Executive Director of the International Society of Pediatric Innovation, iSPI, and the Program Manager for the CHOC Sharon Disneyland Medical Intelligence and Innovation Institute, MI3. She's an associate of CHOC, Children's Hospital of Orange County, for over 20 years. She began her career in patient care as a board-certified pediatric dietitian for a CHOC Mission Pediatric and Intensive Care Unit. In this role, she served as a liaison between CHOC and Mission Hospital, ensuring pediatric best practices were implemented through policy and research, regulatory and qualitative improvement efforts. She is an advocate for women and children, and she has held medical advisory and leadership roles to champion healthy food access in K-12 schools, better infant formula quality standards, and increased opportunities for women entrepreneurs. The second guest is Debra Bogard. She is currently the director of the CHOC Sharon Disneyland Medical Intelligence and Innovation Institute. Prior to joining the MR3 team, Debra served in several leadership positions, including as a consultant to CHOC Pediatrician-in-Chief, as an executive director of the Pediatrics Subspecialty Faculty of CHOC, and also as a chief administrative officer for the Department of Pediatrics at UC Irvine. She's been a consultant for her first 5 Orange County, and she has served on a number of nonprofit boards. So in their roles together with MI3 at CHOC, Debra and Tiffani are part of a dynamic leadership, which includes MI3 founder and chief Dr. Anthony Chang. They are leading groundbreaking medical intelligence and innovation initiative, and I can witness for that because I've experienced it firsthand in our collaboration, including other things like launching an international society for pediatric innovation at the Medical Intelligence Society, among others. Okay, and with that, welcome Tiffani and welcome Debra. How are you?
I am fine. Thank you for having us.
The pleasure is mine. So it's a wonderful morning here in California. I'm in Laguna Beach. Where are you at the moment yourselves?
I am in Laguna Beach as well. We're neighbors.
Probably can wave to you. How about you, Debra?
In Aliso Viejo.
Excellent. Listen, there's many reasons that I wanted for a long time to have you as guests. One of them, because of the fantastic work you're doing in innovation in this field, but also practically because we initiated about a year ago or so a collaboration in this field. So I have lots of questions for you, and we have about an hour, so we'll try to be efficient. I'd love to hear your thoughts on this. I also have a concrete example of what we have been able to do together. So I have a video example that I would like to share, and a little bit of a surprise on some new technologies that are around the corner, and I believe that there are potential to expand our collaboration. So we put together some of these thoughts. So think the lead that children health at Orange Counties is rapidly, I understand, becoming a leader in innovative uses of XR in the medical setting. I believe that's correct. And for anyone that's not familiar with children's health of Orange County, can you provide us a brief overview? I don't know. I will answer generally. By the way, when I ask questions, the best way, rather than me pointing who's going to answer, that one of you take the lead. Okay? Go ahead, please.
Got it. I'll go ahead. So CHOC opened in 1964, and we had 64 beds at the time that we opened. So from a children's hospital perspective, we're considered relatively young. At that time, we were purchasing our operating rooms, our ERs, our pathology and radiology from the Sisters of St. Joseph. And then in 2013, we opened our own tower, the Holmes Tower. And in that tower, we opened our ER, OR, trauma center, PATH, and RAD. So today we have 334 beds at CHOC. We have our hospital within a hospital in Mission Viejo. And we also have outpatient primary care subspecialty offices all over Orange County. We're a teaching and a research facility and a longstanding affiliation with the University of California, Irvine. And our mission is to nurture, advance, and protect the health and well-being of children. And innovation is a key part of being able to do that.
Yeah, I cannot think of a more important thing than health for children. And to see what you're doing is really amazing. Now, I had a pleasure to, in our multiple interaction, to really experience the culture of innovation that dominates at CHOC. Would you mind sharing with us how how CHOC was able to create this culture of innovation?
I might take a stab at this, Deb. Apart from our Chief Innovation and Intelligence Officer, Dr. Anthony Chang, we are so fortunate to have a CEO, Kimberly Cripe, who is such a visionary of creating innovation as one of our core values. It's part of our DNA. But our former pediatrician in chief, Dr. Nick Annis, whom you met many years ago on our first field trip to EON, had such a vision with Dr. Chang. The two of them realized that this is something we had to do. And so having the support of our senior leadership, being able to take these opportunities and boldly push CHOC into these new areas that are not typical yet in medicine, this is what makes CHOC so special. And so having this longstanding partner, and I know Deb can speak better to Dr. Annis's vision, as she was his right hand for so many years, but this is really one of the most important things that initially had us reaching out to you and seeing what we could do together.
Yeah, no, I think there's not a better way, because our collaboration entails virtual and augmented reality. And as you all know, this is a very visual technology. So I thought, what a better way than to actually show a brief video of what you've been able to achieve with our limited support here, but how you drive innovation forward. So what I'll do, if you don't mind, is I'll share my screen. You're going to have a little ghosting effect that goes over momentarily, and then there is the video. So let's look at that a second and go to presenter mode. There you go.
My name is Andrew Reese, Director of Imaging Services here at CHOC Children's. I am honored to be with you today. I'd like to introduce some members of my team who worked extremely hard over the past few months to incorporate innovation with the patient experience. This amazing group of individuals work every day on the front lines of patient care, and their input on this project is critical to the success of the module, or what we like to call MRI with Chaco.
I am super excited to work with EON on an amazing new project. CHOC has identified a handful of MR associates to collaborate and bring expertise to something that's really cool. We have spent countless hours scripting, walking the halls, creating measurements to perfect what is going to be a really neat experience for the kids. I can't wait to see the faces of the kids when they look into the iPads and see the cool experience.
So a big problem that we're trying to solve here at CHOC Children's is to decrease the stress and anxiety that a pediatric patient could have when experiencing an MRI. A lot of patients that we have, they come in and they're super fearful. There's a lot of new faces that they're meeting. There's a new environment. Some of them have already done this a few different times, and just to have a little bit more guidance and support always adds a little bit more comfort. So our vision with collaborating with EON Reality is to really come alongside the patient and to support them every step of the way. So there are a lot of different opportunities on this project that we've been working on that allows our patients the opportunity to play, and we have opportunities for distraction, opportunities for education, and to really allow them to feel a sense of control and autonomy when coming for their MRI appointment.
This new program is definitely going to be helpful. A good example of this is yesterday I brought a young boy, about 5 years old, back with his mom. When I got into the room, I explained to him that we were just going to be taking images. There wasn't anything he needed to be afraid of, and we were there to care for him and to take his pictures. And that alone kind of helped just relieve some of that anxiety that I could tell that he really had. So I feel like this new program is definitely going to help us expose them to this information early on to help them in taking away some of that fear of why they're there, just kind of teaching them and helping them to play games and be comfortable in our area.
Our goal is to reduce the parents' anxiety when they come in for the exam with their child. So what we're trying to do is we're trying to give them enough information before they arrive for their appointment so that their anxiety is lessened and therefore their child's anxiety is lessened. So once they've made their appointment, we're going to be sending them a link, and on that link there'll be a picture of our scan room, and on the picture they'll be able to click on the areas of the scan room so that they can see the equipment, and it'll tell them what the equipment is and what it will do. And they can therefore turn around and tell their child what they can expect, show them what the room looks like, so that when their child comes, they're not so anxious when they have to walk into our room with our big camera.
Hi, my name is Matt Taylor. I'm with EON Reality. As a project manager, I've been able to help collaborate with CHOC to help solve problems. This has been an exciting journey working closely with the radiology team to create iterative storyboards and better understand the needs of the patients and parents. We're able to use EON's industry-leading platform to help clinicians, parents, and patients. With the help of my team of artists and programmers, I'm looking forward to creating more modules for different departments throughout CHOC.
We are designing a suite of medical modules that will encompass a wide spectrum of applications. All of these modules are the first of their kind and will evolve and improve over time. This is an exciting time to play a role in this new technology, and I'm sure you would all agree.
Listen, I wish I had something like this when I was a kid and I had my first interaction with hospitals. That was not the type of experience that we see here, for sure. So let me just see if I can get to stop this 1 second. Yes. A minute. And then we need to turn off the presentation, and we'll go back to the webinar. There you go. Okay, so that was interesting. Any spontaneous comments to that video, anyone?
Yeah, I think one of the key things really was when we brought EON on board, it was that learning curve on both sides. So we needed to learn what the technology could do. So we were asking how might we do this? How might we do this? Can it do this? Can it do? And the EON team leaned in and wanted to learn about what we were doing, what problems we were trying to solve. And then you match that to where the technology is going to best be able to solve those problems. And you think about what these kids and parents traditionally get when you go in, like you said, when you meet with the doctor and they're telling you your child has this heart condition or your child's going to need this procedure, and then they and you take that stack of paper home and try to explain to your spouse and other caregivers what's going to happen. It's impossible. I mean, and so being able to, you could see the relief on our providers' faces when they're knowing they can provide a better solution. And that's what our partnership and our relationship with EON brings, is that ability to ask, how can we work together to improve?
I think that this module also really demonstrates the differences between pediatric healthcare and healthcare in general.
Yeah.
We are, the child is our patient, but we practice family-centered care, which means that we have to speak to everybody. And much like Debra was saying, when one parent may be there at bedside with the doctor but has to go home and repeat it to other family members, especially if there's instructions involved, being able to repeat that learning is really, really critical. This particular module is about reducing anxiety, but some of the other ones that we're using for educational purposes are very important, not to mention having the right language to translate into if there's a second language. So it really is a unique thing, and I'm sure it's a bit of a aha moment for you guys as well, because pediatric healthcare is very different. They're not just small adults. They have very different medical conditions that we treat, and we have to meet them at the developmental stages that they're at. So with this MRI module, we made one for the patient, which you saw here, but we also made a separate one for the parents so that they could have that higher understanding of the logistical, what is the machine? What questions should I ask? And our hope is that when they go back to the doctor, that we've elevated their understanding so they can ask very targeted questions to their physician and help them really have a good understanding and know how to advocate for their child within healthcare.
Yeah, wonderful. Now, I must admit, I've been in this with EON for 22 years and been in this simulation industry for 36. And the best innovation and the best results that we ever got is when you have the honor, pleasure, or luxury, whatever we call it, to work together on a project like this. It's not always like that. But what I really enjoyed in this is that there was this, because you are experts in pediatric healthcare, right? We are perhaps geeks and experts in virtual and augmented reality. And those are two different worlds. And in that conversation, communication, that's where you create magic. So you were talking about some other uses than the ones that we just saw in the example. Would you like to elaborate any further about that? Or any of you, what you see now is done and what you perhaps would like to do in the future?
One of the modules that we're also working on is with our cardiologists. And the problem that they're trying to solve is, again, as Tiffani was saying, that the parents are shocked. They're not necessarily understanding it, and so important that they understand. So being able to work with EON to create cardiac modules where you're able to show a healthy heart, and then you're able to show a heart with a PDA or an ASD or another condition, and able to explain to the parent, and then the provider can come in and discuss that. And even maybe better than that even is to then provide the parent with that QR code, and they can take it home and they can rewatch it and listen to it as many times as they want. So that's really key. And on top of that, being a teaching hospital, we're not only teaching residents and fellows, but we also teach nurses. We have a very prestigious internship program. We've graduated over 550 college, high school and college students who are going to be clinicians. And they're walking out now also with this ability to understand how XR can be used to solve problems as well, and how that augments their training.
Absolutely. Now, looking at this process, I'm quite curious to see, how do you decide, and this is a question for Debra, which modules you would like to create?
I think that's that two-way learning curve. So part of it is what problem are we trying to solve, and is XR the best way to solve that problem? So again, it's that two-way learning curve. And because it's all advancing so quickly, XR and medicine, it's a constant and ongoing conversation. So we always want to be asking, how might we? But now we want to be asking, how might we solve this problem with XR?
Absolutely. Tiffani, you've been a great champion, and we're very grateful for your contribution. And I would say, without your contribution and Debra's, we would never have made this project. But what do you see the future holds when it comes to uses of this type of technology? And what do you anticipate will be some examples or some practical examples in pediatric healthcare?
Well, in our department, like Deb mentioned, we're just getting started. So the list of clinicians now that is starting to line up is getting long. They're excited to see, they know that this is an amazing tool. And that's the great thing about the EON platform, is we have that ability to scale and reach a lot of people. But again, Dr. Anthony Chang, our Chief Intelligence and Innovation Officer, who specializes in AI, that's the moonshot, right? To start bringing in AI-enabled solutions within this visualization tool, it's going to have a significant impact on the way that healthcare is delivered, not just in how people learn or visualize a specific condition, but it's going to enable our providers to have solutions in a faster manner. So building out the data behind your platform and coupling it with all the details of what we practice in pediatric healthcare, this is what we see as the future of XR. And I know you guys are excited to go there with us.
We are super excited. And I couldn't agree more that, in fact, the biggest usage for XR, in my humble opinion, is to connect humans with AI in a more intuitive and natural way, if you look at the big picture, right? And we've been tirelessly working on that. And in fact, perhaps this is the time for I had a question about challenges to Debra, but if you don't mind, Debra, I'll wait with that question. And I will move on to share something of the exciting activities we're doing, and also reach out to you and your colleagues to see how we can explore research activities related to AI. So what I'll do again is the little exercise of sharing my screen. And let's go for that. I was in Korea just 2 weeks ago and invited there for the 4th time to talk about what they refer to as the AI implementation through the metaverse. And I don't know if you how familiar we are with this term metaverse, but in essence, what it entails. So it's the ability to have, in essence, VR AR space in which the user can interact with the computer-generated environment and other users. But this is driven by things like artificial intelligence, IoT, and big data. And I don't know really why they invited me there for the 4th time, but there were some other quite high-level personalities there, and I shared my vision. And I kind of tried to do it in 2 ways. One is to say, okay, what's the future going to look like with exciting images like you see here? That we call, by the way, merged XR, when you merge physical environments and you actually inject digital data in the physical environments. And the other one is what we refer to as spatial meetings, the ability to meet other people from other corners of the world, but while you are you teleport yourself to a real environment. And how the teaching environments of the future would look like. So this was kind of a visionary statement of 2031. And then I said, but wait, a lot of these things are actually possible to do now, 2021. And then I highlighted a little bit of things that you are familiar, how you go from a physical environment to a digital environment by use things like XR. And I'm not going to bore you with that because you're familiar with that. And how to bring those environments to life, but how to do that in a context, for example, in the medical arena, right? So things like, for example, operation rooms, scientific laboratories, and improve things like safety, security, and health. So then we had a concrete example of how to merge those worlds. Where you have first stop was going to where the idea is to do it so simple so people like you and me can do it using just our phones, right? So do it in a very simple way, and to create a digital twin. This happens to not be medical example, but I'll show you medical soon, where you have a digital twin that you created of an MRI device that took a minute, and then you find a couple of points where you link the digital twin with a physical environment, and then you superimpose information in the physical environment. And this information is rich, meaning that actually there is identification using artificial intelligence. So we're using artificial intelligence to identify the annotations and populate them with rich knowledge, everything from videos, PDFs, and the like, right? So that's something that we see a very useful for, among other things, the medical arena. So I have an example there that I'll share with you. And this was taken yesterday because I knew we were going to have this meeting. So you have an operation room. So this is one of my colleagues that invited me to join. He was somewhere in Orange County. He holds a mobile phone in front of his eyes, and he's physically walking in one of these scanned or environments. Let's have a look. So what's happening? So he couldn't be inside because the operation room was too big. So he had to go outside. And here there's a doctor. That doctor can be live. By the way, that's the Amazon track. That's Prime Amazon. That's the future, by the way. We all sit home and learn, and then Amazon does everything for us. I'm joking. But let's be serious. So equipment that could be millions of dollars and not accessible for people someone can log in from Bangladesh or any corner of the world and go through that scenario. And you can see here, that's a good picture. You have avatars, and these avatars can be real, meaning that there's a real person behind it. So that moves with the phone. So when he walks with the phone, the avatar walks. When he points, clicking on something, the avatar points, etc. But you can also have pre-recorded avatars that have a session that for nurses that has to be exercised. And all that is done in spatial computing, meaning that you're in a three-dimensional environment. This environment can be computer generated or can be even real. I'll skip a few slides here to get to the medical side. So you can do this in slices of reality, or you can do this in, I'll show an example here, in merging realities. And I think this especially can be good. I'll only show you one video here. This can be good for, let's turn off the music. If you want to create an augmented reality environment and you have physical stuff, right? Physical things. So you can see there that this is a living room. The sofas are real, but the surrounding, the learning environment is digital. So now when I turn it on, you can see that I have that surrounding me. Now, it is unique to do this, but what I think is even more important is that you can have 4 billion people anywhere just using their mobile device being able to do that and they don't need to have a special knowledge. I'll give an example. When I was in Korea, I also spent some time scanning a street. This is a street, and it took me literally a few seconds to do it, maybe a minute. And then I can take it home to Laguna Beach, and I can see the flowers, and in Korea, and I can invite people to that environment, etc. Now, what about the medical context? So notice one thing that we added is personalized avatar. So it used to be generic avatars like this, so you can select an avatar. But we are now also moving into creating specific procedures, because one thing that the nurses said to us, we want to have more dexterity, more ability to do something detailed. Let's have a look. So this is a simple example where you use this to teach nurses to give CPR. And this is not a video, so the nurses can bend down, look, how they apply pressure and everything. So it's a fully immersive environment that they can download. In this case, it's on a veranda in someone's home. We're also experimenting to do personalized avatars. So these avatars that you see here, although they are not medical relevant, they show the capability of taking, within 30 seconds, very high dexterity movements capturing for different procedures that you can do. And that's not coming in the August release. Everything I showed you now comes in August release. So I'm playing with the beta, except the ones down, which will take us probably to September. So the reason I'm showing you all this is obviously for a simple reason, that I would like to hear, first of all, I'm very excited. That's apparent. But beyond that, what we like to see is how we can find ways. I want your spontaneous thoughts, and we're not going to solve it in this webinar, but where you see this type of combination of things can be used in your opinion and a reaction perhaps to this new functionality. Thank you.
I have some thoughts on this, not being a physician myself, but physician adjacent. One of the most important things is the upkeep of skills. And when you have certain procedures that you may not do frequently, we have a simulation team at CHOC that practices and runs codes so that they can really hone those skills. Mm-hmm. This is a very important area for being able to create different scenarios. I think most people can relate to the pandemic when when many hospitals had to deploy external beds for their hospitals in disaster planning. So it's not that the education doesn't exist, but this is the new landscape, the new format to do it, which again allows that enhanced visualization and collaboration, hopefully at a lower expense, because what you're describing here is accessible, where you could actually have different regions collaborating. It doesn't require travel. And then again, the ability to hone and practice that competency over and over again, because when you're in a critical situation, our doctors have often described it's like a muscle memory. You just have to have that skill hardwired into you, because when you're in that space, you need to react. And so in medicine, and especially pediatric medicine, again, because you could have a neonate, which could be less than term baby. You could have a 4-year-old, you could have a 10-year-old, or you could have an 18-year-old boy that looks like a man. That is a huge range. And so if you're intubating or doing compressions, those are different ranges of patients. So I think there's a lot of applications. So those were just a few that came to the top of my mind. What about you, Deb?
I think it's just really exciting to again, just think how limitless this is. If we can dream it, you can help us do it. That's, I mean, our providers are just absolutely appreciative and excited about the relationship with EON, and again, how they can just approach you and say, here's what we want to be able to do. Is this possible? And you help us make it happen.
Yeah, one of the reasons I started with simulation 36 years ago, I was fascinated about situations, especially emergency situations that are unpredictable. And it's almost impossible to train theoretical for them. I'll give you, and obviously this 36 years ago, it was aircraft simulators, right? You put a pilot in a simulator, you put in the Andes where the air density is different, you turn off an engine and you put a storm. And then he has to somehow use all the combination of skills acquired over decades to be able to land safely that aircraft. And if you look to your arena, that happens every day, right? You have every day a situation like that. But how do you train that in a cost-efficient way? So that's why I like your examples, your ideas, because you can envision that we all are uploading now special meetings, and you, let's say I'm trying to be a nurse and I'm my second class and second year, and I'm almost there. And then you as a teacher says, okay, Dan, ready? Today we're going to do this. There's a patient coming in and this is the situation. And now you're on, right? And every move I make, every step I take, the system is capturing that. You are observing me. And then you can really safely say that, okay, I am ready, right? How do you train for that deer in the light moment that always happens? So yeah, I think that will be a fascinating area, and it's now possible. That's what's so fun. But going back to Dr. Chang and artificial intelligence, where we are pushing the limits now is, I don't know if you noticed, but we are able, once you scan an area, let's say this is a operation room, integrating Google Lens. I'm sure you're familiar with Google Lens. You can hold your phone to anything and it will tell you what it is, right? So we deeply have integrated with the AI there. So it immediately starts recognizing objects. Okay, this is an MRI device. This is etc. And because it links the word with things, it also can search for things that are safety related, right? So an MRI device, there's certain basics. There's a magnet field. You cannot enter with a watch. There's a range of things that you have to be precautious of. So where we see this leading is that we create a working environment and a patient environment that's safer, where AI is watching over us, what we're doing, where we are, who we are, what our skill set is, and then our XR is the conduit. XR is the link between our brains and AI, because I don't think, at least not in my career, that we'll have neural links where it links directly wirelessly to the brain. I know Elon Musk is working on it, but it's going to take some time. But I do think it's realistic to have these things apply in that context. So I'm super excited about that type of usage. So we'll have more discussions of that, and offline we have to talk about this. Listen, I had I'm an engineer, so I like challenges. And life is not only easy and wonderful. There's things you have to overcome. We're all familiar with that, especially during COVID. So what would you say, Debra, was some of the challenges when we implemented the first phase of the project, the things that others may consider when they are thinking about implementing this?
I think one of the things I think about it are a lot of the industry partners out there that are potentials for children's hospitals like ours. A lot is very focused on adult care, right? And finding industry partners that are willing to step into the pediatric space is always a challenge. So again, just really appreciative that EON is on this journey with us. Tiffani,
I love that you bring up the challenges, because so many times we get on a webinar and we all talk about our big successes. But I think people are really engaged and they like to hear what did you struggle with, because it is a learning process, and coming alongside and having this partnership, we knew a lot going into it, but we also knew that there was going to be a lot of discovery. And so as we got into this project, I think getting the language, you essentially had to learn a foreign language, not just medicine, but pediatric medicine, right? And really being able to prioritize what is really important to the caregiver, the family, the patient, and not just a standardized learning module that you might have from a teacher, which is really kind of a one-way directive, and then you test a competency. This was a real exchange. It had to evolve to make sure that we were checking ourselves. We took an entire multidisciplinary MRI team, for example. You got multiple inputs from different perspectives, and we had to construct something that would satisfy the needs. But you know what? It makes the success that much more sweeter. And ultimately, when you do those betas where you actually take it to the kids are going to be the hardest critics, right? Because they will tell you exactly what they think. They are little digital natives that have this hardwired. They know all the equipment, the devices. And so that really allows us at CHOC to provide something that really strikes a chord with them. But then at the same time, it's serving those educational purposes. So I think it was a really interesting trial run. And as you know, we had a couple of other potential projects before we landed on this one. And I think ultimately we're starting to construct a model that will help us get faster and more efficient as we go forward.
Oh yeah, you are really trailblazing this. I can talk with facts and experience. We have 42 million people that downloaded a viewer, and you are, in terms of pediatrics, leading a force at the moment. And we hope this continues. We know that continues with this type of partnership. Now, you're right. We have to focus. And we had a couple of moments where I scratched my head, because I'm an engineer. I like problems, but I also want to keep it simple. But I also remember what Einstein said. He said, make everything as simple as possible, but not simpler. And meaning that it has to do the job and satisfy that specific environment and that specific knowledge. And I think we achieved that, and looking forward to the next in this context. Listen, I have a question, not regarding XR, but I'm curious, and I think many of our listeners are curious, how you navigated this terrible pandemic and how you had to change your processes, all kind of processes to accommodate that, and lessons learned, not necessarily XR, and how you think this will influence you moving forward. If one of you wants to go for that, or both.
I'm happy to jump in from the clinician point of view. I think we are very fortunate that we work for an organization that, many hospitals not only communicated with each other, but our response, we deployed a command center immediately. And very quickly, like most places, we had to scale up.
Just a second. There's a little bit of a noise. If you don't mind muting yourself, because I think we got a little bit of an echo. So accept yourself that who's talking, we'll mute ourselves just for the benefit of the listeners.
Oh, sure.
And thank you so much.
Please continue. I'll be brief, and I'll let Deb jump in.
No. We want to hear you out. Don't worry.
We really quickly, like many hospitals, had to scale up telehealth and remote visits for physicians. At the same time, we were dealing with daily changes in PPE. If you recall, early in the pandemic, there were shortages. And so we were really fortunate that the active transparency and communication in our organization really allowed us to to stay as ahead of the curve as we could possibly, And one of the reasons in our early discussions with you all was these were very clear understandings of when you have to deploy education that is practical, like donning a PPE. This is another tool that will be in our toolbox going forward that we were really excited to consider. The pandemic is still going. So even as we had the amazing result of vaccines, and I'm going to make a little plug here because the science is amazing. We had to get the vaccines out to people. We had to scale that out. We had to create vaccine clinics for our own healthcare providers, and our IT team did an amazing job in getting that scaled up really well and super fast. And so it is an ongoing thing. And as we look at that continued education, there's a balance of resources, communication efforts, as well as ongoing education. I think that's how we've really addressed it. But I'd love Deb's thoughts on this too.
I think, again, one of the things I love about working for Kim Kripe and for Anthony Chang is that focus on how do you take a situation like this and create a better normal from it. So when you look at that better normal perspective, you look at remote learning. And if we would have had the relationship with EON a couple of years earlier, could we have been, really quickly deployed a lot of modules? And so knowing the value, I think it just helps you see the value. But it also then helps you going forward. How do we continue now this ability to educate people wherever they are? And that includes our parents and our especially our parents and with our patients. And I think too, just that ability also where you get an Anthony Chang saying, well, that's great, but now we want to go here. So I think we've always had that perspective at CHOC of taking the situation, learning from it, and then creating a better normal.
Yeah, no, and I need to take the opportunity to suggest, and we do that offline, to invite Dr. Chang to either our office or we come to office to sit down and with these new capabilities, these new toolboxes that we have at our disposal to brainstorm the next applications, right? And where we infuse AI, because we already are doing it, and how can that benefit? So I would love to be part of that discussion if possible. So that's one thing. Another thing that I also would like is to start sharing what you are doing. It's wonderful. I mean, this is a way to share it. We also have an opportunity in early, I think it's towards September. Yeah, September 13 or something. We are doing EON Experience Fest. We invite thousands of people from abroad. We hope at least 300 will attend physically, and the rest will be, of course, online. And I would like to invite you as one of the keynote speakers there to share those experiences, because we have a lot of communities in healthcare that would like to learn more. Okay. Now, I just got to be 59. So 59 is a tough age, because you know that after 50 comes 60, and that's kind of, it's kind of, it goes down the slope from there, right? Then you start figuring out, okay, I have 3,000 days. Well, I'll be really functional and can still exercise and play my tennis. Maybe I have 7,000 days. That's 20 years. Well, I'll still be around if I'm lucky and keep my health and exercise. But I will be maybe not as active. I was watching yesterday, Clint Eastwood is 91. And he said, there's a time where you can age gracefully, but unfortunately it's too late for me. So, but with medical advances, who knows? We may age gracefully at 91, but realistically, you have a limited time, right? So that's when you start to ponder things like, sorry for being macabre, but what will be on my gravestone, right? It's good to think about that. It sounds maybe negative, but if you think about what would it say there, right? And try to live the rest of your life in a way that you actually fulfill it. So in my case, everybody we are limited by our lives, by our careers, by our the circumstances. So you can only do so much, especially as you advance in age. Your possibilities narrow. The takeoff is just about to happen, right? So in my case, I plan to continue to dedicate my life to knowledge and knowledge transfer. And I plan to, I believe in knowledge as a human right, and I want to make it available, accessible, and affordable. The pandemic offered us a wonderful opportunity to reach out. We've had 73 countries that have joined. We distributed more than 933,000 licenses around the globe. And you start to see the impact, and it's amazing. But of course, I'm ambitious, and I think you are. So one thing that I would like to see in the next 10 years is how this will impact healthcare. And so here comes my question. All this blah, blah, blah was to get my question. The question is, we are sitting, it's 2031, and you are now invited again to a webinar with me. And we're all exercising and are fresh, don't look much older, actually, who knows? With life prolongation, we look even younger. But the point is, how do you see this potentially can be used 10 years from now to make a difference in pediatric healthcare?
My first thoughts are a couple of things. First of all, I appreciate your comments on legacy, because it's part of the reason why we have an internship program at CHOC, because not everything that we are gleaning and discovering, we want to pass that on to tomorrow's doctors. So our partnership with you is making that experience for them so much richer. So you never even know the seeds that you're planting, and they are having exponential returns. So I very much understand. And then also from the perspective of the family and the patients that we serve, they have the greatest sense of urgency. So none of us feels like we have any time to waste. So I love that we all have that intention behind us. That's why we get into pediatrics. That's what we do with our efforts. I think in 10 years that this is going to be, probably won't even need to have a discussion about it, because it's going to be so naturally inbred into how we do things. Mm-hmm. Once you learn to visualize things, it's going to be the standard practice.
It's not going to be XR. It's going to just be
more. It's just going to be life. It's just going to be exactly. Life. And I think what we've learned in our journey, for me personally, right now there are certain things that are more akin to augmented reality versus needing an entire immersive experience. And we're kind of differentiating and finding the opportunities of how getting those quick wins. How can we quickly deploy something? Some people really love the immersive experience. Others like it in the other way. So one of the things that I loved about EON straight out the gate was how you were device agnostic, and that you had these other, the range of assets and how they could be used. But I really think in 10 years, we're going to be having an entirely different conversation. I think that we'll get much deeper into the AI. I don't think it's something that people necessarily need to be afraid of, but as you look at and wrestle with data sharing efforts, the legal ramifications of it, the ethical ramifications of it, those are the things that will evolve over time. But that's my short answer. What do you think, Deb?
I think one of the other things too, Tiffani, when you talk about part of the reason that our relationship with EON works so well, that we're so like-minded, is the ability to, and the desire to share what we're doing. And that was why Dr. Chang created the International Society of Pediatric Innovation. So just like, you're spotlighting all over the world what XR can do, and Dr. Chang and Tiffani and iSPI are able to share with other children's hospitals, what we're able to do together. And Dr. Chang's desire is to democratize AI and make it available to everyone. And so I think it's really that like-mindedness, but also that desire to lean in. So imagining what we can do in 10 years, we're going to be blown away what we can do in 1 year from now compared to what we can do right now. So 10 years, wow.
Wow. No, but I do think AI will play a big role. And let's talk a little bit about AI, because I think it's interesting. So I have a lot of conversation, and I'm sure that you have the same. And as any other technology that's come around, there is a cap that says, oh, this is evil. It's going to render humans useless. We're not going to have any jobs. We'll be pacified. We'll be marginalized. We'll lose the purpose in life. And it's going to be horrible, right? This is the end of humanity. And in the best case, we'll be just pets for these AI machines, right? It's not an unusual sight. Elon Musk has that view. And then there's another view, my view, I'm in the second camp, which is that if we do it right, of course, there will be evil usage, military, defense, nasty things that you can put any technology, enslave people, not in screens, but in virtual reality. You think TikTok is addictive? You haven't seen nothing yet, right? Every single second of your waking time will be captivating in some strange environment. But let's take about the positive side. Let's take away we as partners can make a difference. I think one area is to stand on the shoulder of giants. These AI machines will help us to think, to make judgment calls, to be more protected. So I almost see me as a furry teddy bear that I in a bubble of AI, because my wife says I'm a little bit like Dr. Magoo, Mr. Magoo. I am absent-minded because I have EDD and I always forget things. I always stumble on things. I'm clumsy. So I'm a perfect candidate for AI, right? So it will know then where you're going. Have you thought about that? Or if I take a step and fall 700 meters, you will actually, there will be proximity sensor too. So it would help us to live actually a little bit more protected, but also guide us, right, in important decisions. So we don't always, how many times have you not made a decision that you regret because you're in the heat of the moment, said something inappropriate, that actually gets you and knows your mental stability. With this ring, I have a ring here, I breathe any morning, Lumen, I know my carb rate, I know whether I am about today to take a big decision or not. So weaving all those sensors, IoT, AI, will help us, I think, to be in a safer, more humane, and better world. And I think that will liberate a lot of anxiety, and hopefully productivity will increase so we don't have to worry about the daily bread as much as many of us have to do. So we can become 4 years old again. That's my dream. Not to dementia necessarily, but by, you know, if you think about 4 years old, that was the best time of my life, right? You dropped me at the playground, I dipped my fingers in the dirt, I put it in my mouth. I learned that that's not a good experience, but you have no restrictions, right? There was no one to tell you that, oh, you cannot do that, because you didn't know limits. And the society and constraints and family and careers and makes us push us to this, to a smaller and smaller, and eventually you leave this life, you're on a track and you know where the track leads, right? So my dream for the next 10 years is that if we can use this technology to liberate us, to pursue our dreams, right? To plan the next trip to Mars, to work with Dr. Chang and how to help kids in the toughest situation, and have kids focus on that. The 4 years old, the curious, the thing that brought us the last 70,000 years from where we came. It wasn't because we spent time in social media and find fights with each other. I mean, we did that too. But what advanced is technology, it is knowledge. And that's what will, and I think we are just in the beginning of the journey. I don't know if you guys watch the news. I'm sure every day it's so exciting, whether I'm looking at space or I'm listening to Dr. Sinclair on new advances, medical healthcare, almost any areas, and new energy methods, new ways to, so I'm talking too much. But my point is that I hope sincerely that we can embrace that side. But it's not going to happen by itself, right? There's forces. There's always forces. Look at, I love Facebook. I love Oculus. But introducing in virtual reality commercials is death. It's like, if we do that, it's got to go a slippery slope because, and I don't want to go there. So let's use, it's like Star Wars. Let's work for the good force. That's my hope. So your thoughts on this? Do you think, of course, you have kids, right? So you have people with children. So you must think about this quite a lot. What's your thoughts on this and their future using these new technologies?
Well, I think one thing that obviously you're educating everyone on XR and what the possibilities are today, but more importantly also tomorrow. Same with Dr. Chang and with MI3 and not only creating iSPI from the innovation perspective, but then creating AI Med and the Medical Intelligence Society and ABAIM, which is educating and certifying clinicians in AI. So as we're learning XR, we continue to learn AI. And as Tiffani's saying, in a few years, it's going to be second nature. So Dr. Chang obviously hears every day, AI is trying to replace radiologists, or AI is trying to help radiologists,
yep.
and AI is trying to improve, and AI is trying to support and augment what you're able to do, and you do that through education, and it's constant, and it's always being upgraded and evolving, and that's really the key too. Tiffani?
I think, to me, we started this conversation talking about aging and, the length, if we're lucky enough to get old. To me, it comes down to quality of life. So if AI has the capabilities to free up people to make better decisions, to intervene in our own and advocate for our own health so that the aging process is slowed down, we're living a longer, more quality life. I think that with the right approach in this, that the benefits that it's going to bring to healthcare is going to free up people. If you choose to take that extra time and invest it into something worthwhile. This is what I aim for, because we do have many kids in our hospital who are dealing with serious conditions, and sometimes their lives are shorter, but we always aim for the highest quality of life. And I look at our caregivers. We are at an all-time high with caregiver burnout, especially because of the pandemic. If this frees them up to make smarter decisions and to lean into their skills, this is going to give them more job satisfaction. This is going to make them the doctor that they want to be. They don't have to spend all their time documenting something or doing paperwork or worrying about, insurance constraints. It really is, the goal is to build a system that gives people that quality of life in your work, in your personal relationships. This is the vision that I see. Now, I am not the AI expert of Dr. Chang. When I talk to people like you and him, my mind is usually blown. But I think together, this is what we can work to create. And maybe we become stopgap so that I tell my teenage boys, use your powers for good. Because we all know that young testosterone can go one of two ways. And so if we are all challenging each other as peers to use our powers for good, I think the future is really bright.
That's wonderful. We have 3 minutes left, and it's so many topics that I would have loved to cover with you, but unfortunately time doesn't allow for that because we all have hard stops and jobs to do. One thing that we'd like to talk about next time is the preventive aspects of medicine and the use of XR and AI in that. I'm a little bit of a guinea pig because I done my DNA test, and my doctor has all my charts, so they know, all the major fours, heart disease, Alzheimer, all those things that you can, cancer, which of these are there. And for each chart, there is actually medicine, not medicine necessarily, but there is different vitamins and other things that you can take to block those, to not activate those genes or those. So I think, and I hope that using IoT, big data, not IoT, but big data, having a huge data sets of validated scientific information combined with AI to create personalized preventive medicine. And I hope in the next 10 years that a lot of these children that today we have to catch when they already have, encountered that disease, and we can do less. What about if we could try to capture that much earlier in the process? And so things like that. But anyway, time doesn't allow today. So as an end point, I would like to thank you from my whole heart for joining this. I'm so happy and honored and to get your insights in this. But for us, as you know, the dialogue continues when we end this webinar. And I'll offer myself, whether it's next week and then in the coming weeks, whenever you have a chance to set up a session with Dr. Chang and to continue to do this wonderful work for the benefit of CHOC and your patients, and hopefully also help the world in this capacity. Thank you once again for your time, and all the best.
Thank you, Dan.
Take care now. Thanks.
Thank you.